Thank you again for staying to the end. Thank you to Jennifer, Christy, Gary. So when your accountant says you're spending too much on insurance and risk, they call your broker. Get your cost of insurance down. That's generally what I do for healthcare and cannabis across North America. For Acrisure, we're the company no one's ever heard of till now. And then if I'm not successful, you're going to have to call your attorney. So Gary's up next. So what are we? Who am I? What do I do? So Acrisure is, again, a company no one's ever heard of. We actually deal with insurance or risk for 1 out of 8 businesses in America. And the Steelers, Pittsburgh Steelers, play in our stadium, Acrisure Stadium, and I'm from Pittsburgh and played a whole lot of football. And so what I do outside of cannabis, right now my specialty is healthcare workers that get assaulted and attacked in acute care and senior living. So I try to tackle some of the worst things in healthcare and just use my kind of leadership and football skills and never say die attitude to tackle that. So I've been at this for 7 years here, trying to create malpractice that covers physicians for the liability of talking to someone about cannabis, a patient, right? So what I'm going to do here is I'm going to play you a 1 minute, my kind of elevator internet video. Now I will preface this. It's meant for the non-endocannabinologist, okay? Because that's who asked us to really create this out the gate, create this insurance, because if people are coming in, I'll get to more of that later. And I just used a new specialty term there, right? Endocannabinologist. And I'll tell you the brilliance of what we did here is that we created this insurance in Florida. We ran it directly through the Florida Department of Insurance, and they have approved it. And it's been 2 years now that we've been fine-tuning it with them, and we're ready to really kind of get to it. And they allowed us, when you sell malpractice insurance or handle malpractice claims, the first thing is, well, what's the doctor's specialty? And that then drives the rate that you will eventually pay. If you're a neurosurgeon, you're going to pay you're a little risky, so you're going to pay more, right? As opposed to a family practitioner. And we thought, well, we got a lot of doctors that are coming out of VA, they're coming out of practice, they want to kind of get a thing going, maybe with a couple together in a little office, and they need coverage. So that's why we came up with this. And the Florida Department of Insurance, can consider you, when you apply for this, an endocannabinologist. So I would suggest Ron and the team and maybe walk down to Florida State Medical Board, because we can't get them to call you that yet. But they're a state agency, and they work in cahoots, right? They tell us the specialties we're allowed to sell, usually the reverse way, but we got this snuck through. My business partner, Peter Byrne, did that. He's a brilliant man. But that would help you in a few ways. If I can call you an endocannabinologist for your primary insurance, then I can reduce your rate significantly to, if you were an ER doc or, if you're doing something more risky by nature, just medically, right? So again, this is for the non-endocannabinologist, but you can be and are an endocannabinologist, and we're going to pursue that. And after the video, I'm going to tell you another important component that you guys have accomplished for the insurance industry. So it's a big thank you, really. All right, so here you go.
Your patient's cannabis use puts you at risk because your malpractice policy excludes cannabis. Pro-Mal Insurance protects you with affirmative cannabis coverage. Cannabis use is increasing rapidly, along with THC potency. Your patients ask about cannabis, and many use it. Your standard of care must now include cannabis, a complex drug of over 100 cannabinoid compounds that acts on the endocannabinoid system. THC and CBD can be harmful singly or have dangerous interactions with other drugs. You are personally exposed to cannabis lawsuits because your malpractice insurance excludes federally illegal drugs or those not approved by the FDA. Pro-Mal provides CME education on cannabinoids and the endocannabinoid system to better equip you for patient care. Our supplemental coverage for cannabis enhances your malpractice protection for as low as $1,500 annually. Get a quick estimate of your premium at www.promalinsurance.com.
All right, now I'll tell you how we're the only people in the country who pulled this off. And how to protect your business and grow it. So what do I do at Acrisure? We insure, again, 1 out of 8 businesses in America, but we went after mom and pop America with technology and some really smart people and an employee-owned company, essentially. I'm one of the partners. So I have a ton of access to things like AI and things like that, and we find the gap that causes the problem, not try to sell you something out of a, because we think it's cool. So we were asked to kind of build this by physician groups. So this is my 5th convention this month, and prior to this, I got to do the same presentation at the Ohio Hospital Association. I've worked with them for 30 years. The Ohio Nursing Home Association, I've worked with them for 30 years. It's 19,000 or 12,000 nursing homes in Ohio just engaged on this. And I also do risk management consulting for the American Healthcare Association, which represents all 17,000 nursing homes in America. And we have a cannabis problem in these nursing homes. My worst case right now is I have a veteran with no lower limb. He's a fun guy, too fun. He vapes in the hallway. You remember that little trick you did in high school? You'd hit the back of someone's knee and they go down? I just had a nurse break her wrist on that work comp claim. I have to have talks with this gentleman about appropriate behavior, so we're writing codes of efficacy. This is people's homes, things like that. So it's a complex issue in cannabis. And I just toured about 20 nursing homes in Pennsylvania and Ohio, and the medical directors had no idea there was drug interactions. They have families coming and bringing in gas station hemp, as I call it, not knowing the drugs their mother's on, right? So my assaults come into that too, as you can imagine, right? Drug-seeking behavior and violence go hand in hand. So what did we do here? We did the kind of technical, hard stuff that takes a lot of money and coaxing federal aid or state-level agencies to care. All right, so that's over with. All right. Now comes your work back into what I'm doing. All right, the importance of the Florida Medical Cannabis Physicians Group is essential to what we're trying to do here. Why? Well, let's go through the blocking and tackling. I had it, Dr. James asked me yesterday, his wife asked me yesterday at lunch, how does it work? So I could go through all these slides, but I'll tell you how this works now, right? In a malpractice, what you're defending is that you didn't mess up. Well, who verifies that you didn't mess up? Your peer. So what malpractice does, so let's go through a typical claim I'd be dealing with right now. Let's use my mother as an example. My mother has a pacemaker. She's 73, and she has arthritis real bad in her hands. Other than that, she'll knock you over and put a gun at you if you mess with her. She's from Pittsburgh, baby. My father was a max security prison guard, so she's a tough woman, all right? She doesn't like a lot of help, right? She won't take CBD unless my brother, the pastor, and her doctors, 3 say it's okay, right? But she's now putting into her tea a little bit. All right, so she comes and she says, hey, I'm using cannabis. And you say, okay, I'm aware of this. And she goes to the dispensary, and we know, I call it the chasm, the gap between the acquisition and the medical care, right? And we're fixing that too. I'm education first. I sell insurance because I prepared you not to get hurt, right? And I have a lot of education, right? So my mother, again, as the example, consumes what's Durbin's Poison's on sale at Amplify where I go. So she walks out of there with a 32% THC. She goes, oh, this is a fake case, by the way. My mother didn't do this. Just HIPAA, So she has a panic attack. I live in Pittsburgh. There's a lot of bridges. This actually happened to my friend's wife. She had a pacemaker, and she drove into the side of a bridge off of cannabis edibles, yeah. And we'd been consuming since we were 16. And I'm 50 years old, and she is too. So you thought you know what you're doing, but then you go in, you get a product, and there's a chasm between your health care and what's there. So the advancement of the group of physicians meeting on a regular, and I've gone to a lot of states and seen 3 other entities try to do this. And I heard from James or Charles that you guys are meeting bi-weekly, 40 so people. Crushing Ohio. We meet like once a month. There's 40 the same people for 3 years. But that's Ohio. All right, so that we will rely is we offer this insurance to give us the standard of care so that I can help with it. If you do mess up and you didn't apply the standard of care, I got $1 million in coverage for that $1,500, $2 million, sits on top of your primary. I want to get your primary down because you're not maybe what you used to be or what you went to medical school for, or what you do maybe 80% of the time, but not 20% of the time where you are exposed, right? So we had to keep this affordable. Only a big kind of company that wanted to take on the Florida DOI. I actually got this through Nevada Department of Insurance through the pandemic, and then they wanted me to raise $10 million, and I said, I can't during a pandemic. So Florida said, come in and do it without all those barriers. So we've been welcomed here out of every other state in the country to establish and domicile the insurance here. We now sell it in 6 other states where it's admitted by their departments of insurance, but thank you, Florida. So I loved coming down today just to kind of give that presentation. All right, so now I'm just going to kind of cut through, and we do have some time here. Gary's presentation is really good. I saw him at the Florida Anesthesiology last year, I think, and the way they kind of handle the malpractice side as well, there's like a dovetail, right? Right, and keep your low, and it keeps your overall cost of risk down. That's what I want to do. You can't grow a physician's practice in a risky new venture without keeping your operating costs as low as humanly possible, and that's really what I do, right? And help you also grow and market that success as a certified, maybe, cannabinologist. Maybe the association can put a sticker on the door when they're coming in saying, I am trained, I belong to an association, and I am not just giving you a card. I'm doing this with my nursing homes. The association is going to say, if the medical director takes my 5 CMEs, I'll put a sticker on the door saying, hey, family, don't sneak it in. We got to talk. Because if you try to do it with a slap, you're going to get more sneaking. Right? So you got to engage. So now we came up with this. So a friend of mine named Dr. Brenda Wells out of East Carolina University, where a lot of brilliant insurance minds are trained by her, tenured professor. We wanted to survey doctors. So about 6 or 7 years ago, we surveyed 15,000 doctors. You know, as an educational institution, she was able to get around the into, and she was engaged on, you know, the gap. She's always teaching, looking for the next thing in insurance as an educator at the high level. So we did the survey, and you can see the results there. That's why they then kind of came to us. Some of the doctors associations I work with, hospital groups, I form insurance captives. They're coming saying, hey, we get this question every day. And then our legal comes down from the healthcare system and says, hey, we got too much CMS Medicaid money, Medicare money. It's a federal contract. We can't talk about this. So just let it, we'll just put our heads in the sand, send it to the guy down the street, maybe you, defer to liability, we call that in insurance. Bring another professional in, you defer to liability. Right, so they said, I have to talk about it. My employer's telling me I can't. I want to be covered individually. So Florida made us do this on an individual person basis. So it's sold on an individual basis because of, you know, my employer can't help me. You know, so now we've kind of grouped it enough and got it going enough to kind of keep it super kind of focused on education and affordable. But you can see their education was the main ask, and that's when my brain goes, I got to create some kind of insurance thing to handle this, because I dealt with the pandemic. I dealt with, you know, I do OSHA too. So I did all the no-call, no-shows. I did respirator fit testing, you know, all that kind of stuff. And, you know, we can kind of see coming a mile away. I used to do infant mortality birth rates in Ohio, all that kind of quality measures as well I get into. When the patient or worker gets hurt, it's a problem, right? I was driving here in the Uber. I heard a malpractice commercial, and one out of the third leading cause of death is going to your doctor on the radio coming here. So I told him to turn it off, please. All right. So this is the non-endocannabinologist. That's the look on their face usually at the conference at this point. Okay. And what we're trying to let them know is, I have a degree in biology and environmental studies, and I don't care about the plant and your opinion on it and your ethics and your, you know, I'm a very religious man, but I also don't want to focus on that. I want to focus on, do you understand the endocannabinoid system? The ECS, get the plant out of the room. In a malpractice trial, they're going to pull you up and say, you don't understand a system of the body that governs other systems of the body. You call yourself a what? You know, and that could be how you lose that case, right? So it's, no, we take it, it's a mandated thing. The other thing we do, and I hope you're all doing this, you must have the Florida waiver on patient consent, and there is one by the Florida State Medical Board. I have it if you don't have it. It's extensive. It actually has a page or half page for each of the allowable conditions. And it's that time where you do that intake with the patient and say, hey, I'm going to tell you about the risks and the benefits. I'm going to give you all modes of treatment, and we're going to practice medicine here. I may even give you a prescription and say, go to Trulieve or go to a place and get this. I could care less what it's called. Have them bring out the 3 things that are this, right? And then keep in touch on how it's going. Right, so I'm seeing more doctors around the country going from issuing cards to saying, hey, come back. I pay my doctor, Dr. Bridget Cole-Williams. She's a brilliant endocannabinologist out of Detroit, lives in Columbus, just spoke at the Ohio legislature because they're messing around with their Republican majority right now up there, but not too bad. We were happy. Right? So for an hour, whenever I need to. She has a background in psychology, weight loss. She was a family practitioner at the Cleveland Clinic. Left to do this. And she charges me out $250. I handle her insurance. We pay each other like professionals, and she lets me talk for an hour. And she says, go get this up at Amplify. And we call back if they don't have it. And I go, and I've gone through a weight loss venture with her. I have anxiety. I play college football. I had my rib cut out a year ago at University Hospital. Used cannabis through the whole thing. Haven't drank in 2 years, right? So it's real. It's real, and people are starting to see it. Doctors are saying, hey, I was issuing cards, or I was trying to talk my patients out of it. One of my makers, Janice Knox, Dr. Knox out of Oregon, and her daughters and husband had trained me in endocannabinology years ago. And she said, I was trying to talk people out of it, but they kept getting better. She's a very conservative woman out of Louisiana, now lives out in the West. Education. I love that graph we saw the other day when you go into NIH, PubMed, and you see that graph when you do the research. So my partner Jesse was here from Acrisure. He's been doing insurance on clinical trials for pharmaceuticals. He just came to learn, and he said, say thanks. He had to run back to Texas for his boy. And he learned a lot about how clinical trials might roll out for cannabis and how we're getting ready to insure those, because that's his thing, right? And he didn't even know this convention existed, but he came on the weekend, and he was very grateful. So we are looking for an education partner right now, actually. I do have a thing with ACS. It's not really working, and so I'm looking for maybe again the group of physicians to tell me, and Acrisure, and in the ProMal side. I have nursing home medical directors that need education right now, and I have no one to give it to them that's qualified. And I talk too much, and they don't trust me as a physician. Obviously, they've known me a while, right? So I handle work comp claims. Stu was up here the other day. Baskins, he does some great work as an engineer, and he was benchmarking the work comp claims. I have employers. The Ohio hospitals met. I was in the meeting. I'm on the board of the workers' comp group. We voted to not test nurses pre-employment, post-accident, or annually for cannabis. Every hospital in Ohio. Yeah. Now, I have a nurse that gets assaulted. I had someone get a crucifix dug into her back on an elevator ride that was 3 stories by a bipolar patient break by herself. How do I get her back to work with mental health and cannabis? I don't have case managers to do that, but I have employers willing to pay for it. I have TPAs willing to pay for it. I have, there are states like Pennsylvania that mandated the employer pay for the cannabis. Now we can lean into this because we have professionals that have come out of the and we've trained ourselves for years now to do this, right? So let's insure it, let's educate. If I educate, I don't have to worry about being in court all the time. And here's what I'm doing. I just did this with a bunch of medical directors for the nursing homes. I'm like, do you know what CBN is, CBG? Do you know there's more than 2 cannabinoids? Do you know what terpenes do? Do you know how to read this label? And they're like, what the hell does that say? And I was like, again, you're a medical director. You're passing pills. I have people under the end of life care with you. Where are you? Show up. But the employers now, the owners are hearing me because they're seeing the insurance. But here's what happened in Ohio. A year and a half ago or so, we had passed adult rec use through a voter initiative. We can pass laws as voters in Ohio. And we did. It was like the 3rd time we got it through. We already had medical. And a very good medical system as well. Quality product. Good docs, train and meeting like you. I said the 40, but there's more engaging. And again, I just spoke at the hospital and the Nursing Home Association, right? But we need more of peer-to-peer is what we got to facilitate. We've been trying to do it, but it's like, no, it comes better peer-to-peer. So we're the kind of platform, and we need to teach people and families to read this stuff, bud tenders to read this stuff. Insured dispensaries. Acrisure came out for cannabis insurance back in like 2018. We have the people that sold some of the first policies, the dispensary, Golden Bear people, stuff like that. And we have this connection with these dispensaries and these processors, and we're like, again, why aren't you engaging with the medical community? Oh, we can't. It's not true. We can insure them. Every law state where a medical cannabis program exists, the physicians are criminally not liable. That's in usually the statute level, right? Now we're adding the layer of you are not civilly liable. So there's a little bit more malpractice education. Malpractice is, I explain it like your fence is over the neighbor's line. That's all it takes to sue you for malpractice. Your fence is over your neighbor's line. I don't like it. My mom will sue you because she had the panic attack and you said it was going to be fine, and I told you I was on it, and you didn't tell me this was going to happen. And I'm Italian, and I got a lot of cousins, and about 7 of them are lawyers that love my mother. Right? So that's what malpractice insurance pays for, your defense. And then there's also so if you look at your malpractice policies and it doesn't say defense within limits, like earlier I said I give you $1 million. Well, I'm paying the attorney to defend you and keep your license and say, the Florida Medical Cannabis Physicians Group has a standard of care and she didn't break it. So we're defending her. I'll spend the money on the defense, keep your license. You also have separate insurance to defend your license. That's one thing you need to know. I had Dr. Knox up in Oregon, again, one of my trainers, had a case with a pediatric. 2 doctors did confer. We worked with the parents. They're very happy, right? But there was one of those 10 to 1, 1 to 10 switches at the dispensary, and they dosed it with THC, and the baby had a seed, and and everyone looked into it, and doctor was like, they lost the paperwork. They're both like kind of in their 70s to 80s, and they run a lot, and they just missed a piece of paper. They did the work. The family was happy. No one was upset on that side. Guess who turned them in? A peer, a physician in Oregon who does not like cannabis, right? Well, that I couldn't cover on malpractice. You have to have, defensive license insurance. It's separate. Yeah. Okay, I'm almost done. You're a great moderator. Dr. Newton stole this. Can I do that? No, I'm not Dr. Newton by a long stretch. All right, so when malpractice claim comes in, here's what happens to it. There's a thing called the National Practitioners Data Bank that all insurance companies have to send the claims to. They're categorized. We analyze the data like work comp, and we see how you guys mess up. 9% of those claims are drug interaction claims. A lot of where these fall, not knowing the drug interaction, and that's usually the cases we'll get. The other bad ones we're seeing are waking up under anesthesia. Colorado emergency surgeons did a study on it. One of my attorneys is out of California, cannabis expert attorney. His wife's an ER doctor in California. She sees, I think it said emesis syndrome, the vomiting, right? And then a case up in South Dakota, patient went through a course of treatment on, irritable bowel, colon issues. He was just consuming, 4 grams a day. And the doctor didn't catch it, but went through that whole treatment protocol. So people were pretty upset when they were heard like, oh, if you take a hot shower and it goes away, you didn't have to cut my son's colon out. I want your house, right? So that's, again, for the non-endocannabinologist, I have a very hard job. So what I do is I go to their associations. We go to the anesthesiology meeting. We go to the ER meeting. And we say, you got to give me a standard of care too. Because, you guys got to put it together. And there's enough momentum to do that now in that regard. And again, it's lack of knowledge of the system. The attorneys will go there. There's a guy out of New Jersey running ads. I'll see your cannabis doctor right now, an attorney. Yeah, the bar's picked up on it. All right, so here's what we say when we say you need the coverage. Doctor, well, there's no standard of care. You can't say I didn't mess up. Those days are over. I'm not liable because I didn't prescribe it. I told you I'm using something that interacts with the drugs. You're in. your care plan, like the medical directors of the nursing homes. They didn't ask them to take it, but the voters passed the law, and you got to incorporate it now because, hey, they're on statins. What's that mean? They don't know. They don't know. So we have to educate them, and it might be up to us to do that. All right, so here's in our travels, because again, I got a team that kind of follows this. We have like 3 lawyers on staff that are founders of this. And, we're looking for the standard of care because that means if you didn't follow it, we are liable and we need to educate you so you don't, right? So again, you guys are right in line for doing it. I know anesthesiology was doing it. Yeah, they had a committee last year. They were working on it in Florida. All right, so back to this, and I'm done. The patient is evolving, right? The practice of the medicine, the practice of your practices is evolving. My mother is a patient. Infants are a patient. People who don't want to get high, main request a lot of my doctors got, I want to use cannabis, I want to feel better, but I don't want to be high. Okay, well that can be done by certain doctors, I've been told. All right, and I felt that body high and I've been focused, so I know it's possible. All right, so it's out. We got Dr. Oz running CMS, that's my other side job. And again, the unpredictability of Medicare and all this other stuff, people are seeking alternative healthcare. Right? And if they have a good experience, you don't even need to run an ad. All right, so the gist of it is, when you look at your malpractice policy, there'll be an exclusion for, if it's not approved by the FDA, we can say, sorry, we're big, you're little, sue us, right? And we actually put it in black and white, we cover it, we define cannabis broadly. We don't cover the synthetic because the debate on whether it's medicine or not, right? And again, we have a lot of folks, doctors. On my board, I have Dr. McLean. I have doctors out of North Carolina where there's no jurisdiction, hospice doctors that said, can you help with this, right? So we could talk about if you're at risk, and why can't the big guys do this? There's a FinCEN rule. Where if they take cannabis money, and I've had several conversations with you, I was shut down selling cannabis CMEs to physicians by 2 payment processors. I had to run it through Canada and Shopify to keep my business open, right? And it's the education we have today. So big insurance companies and big banks won't do it. We carved off a thing that was legal, vetted by a lot of people, and actually approved by 6 state departments of insurance, which is, I can tell you, not easy. It's harder than getting a HELOC, right? A lot harder. So, but that's why they can't do it, so they stay silent on it. You might call your insurance agent and they say, well, thanks for telling me. I'm sorry, buddy, insurance is a contract, and me and my best friend still do business to this day because in between fishing trips, when we're doing business, we write it down, and we hold each other to it because it's business, and we got kids, and we got promises, and I've been hitting the head a lot, so I forget things. So, all right, that's it. I'm going to go ahead and turn it over to Gary right now because if I can't protect you, he can, right? Thank you all.
Thank you. Yeah. Education